Hi, I'm Dr. Raidu, and I'm with the TelAbortion project. I'm going to briefly describe what to do once you get your medical abortion package. Please watch Chapter 2, Medication Counseling, if you have questions about the medications you will take. Your package will contain the mifepristone pill, the misoprostol pills, and written instructions. Your package may look different from the one in this video. Your provider will let you know exactly what to expect in your package. In preparation for your medical abortion, we recommend having these supplies at home. Maxi pads will be necessary for when you start bleeding and passing the pregnancy. I recommend getting the super or overnight pads. Pain medication. Ibuprofen, sold under brand names such as Motrin or Advil, can help with the cramping. Your provider might also call in a prescription for a stronger medication. A heating pad can also be helpful for the cramping. You can usually find one at a drugstore. Snacks and drinks. You can eat and drink throughout the process, so it's nice to have some light snacks and drinks that you enjoy on hand. Support person. Although it's not necessary, consider having someone with you to help you with anything you might need on the day you take the misoprostol. After you take the misoprostol, you'll want to be at home or in comfortable surroundings near a restroom. As explained in Chapter 2, you will need to take 2 medications to complete your medical abortion. You should take the first medication before you are 10 weeks pregnant. The medication works better the earlier in pregnancy you take them, so we recommend starting the process as soon as it is practical after receiving the package. Once you get your package, you will need to plan on when you will take the first pill, the mifepristone. For example, if you get your package on Wednesday and you have Saturday off, we recommend taking the mifepristone on Friday and taking the misoprostol on Saturday. Because we cannot predict the exact time your pregnancy will pass, we recommend having the day free for taking the misoprostol. The timing of when to take the misoprostol will depend on whether you want to take them vaginally or buccally. Your provider will discuss this with you. You can learn more about taking the medications vaginally versus buccally in Chapter 2. If you want to take them vaginally, you can place the 4 misoprostol pills up to 48 hours after your mifepristone. If you want to take the 4 pills buccally, or in your cheek, you would wait 24 to 48 hours after taking the mifepristone. Once you take the misoprostol pills, you will start bleeding and cramping in 1 to 4 hours. Make sure to place a pad in your underwear and take the pain medication or use the heating pad as needed. Once you start bleeding, it's normal to pass some large blood clots. They could be up to the size of a lemon. Most women do not see the pregnancy tissue during the abortion, but it is possible that you will recognize it as a small, pinkish-gray piece of tissue, especially if you are closer to 10 weeks. Once the pregnancy has passed, the bleeding and cramping should gradually decrease over the next few days. It is common for bleeding to stop and restart, and many women have spotting or irregular bleeding for weeks following the abortion. Your next period will typically come in 4 to 6 weeks. For most people, this process is simple and straightforward. However, we are here for you should issues arise. If there are any concerns, please call your TelAbortion team first. Please call us if any of these things occur. If you completely soak through 2 of your large pads in 1 hour, then soak through 2 more large pads the following hour. Completely soaking 4 pads in 2 hours is too much bleeding, and you should seek medical attention. It is possible that while passing the pregnancy, you could soak through 2 pads completely in 1 hour. However, you should have less bleeding in the next hour. Remember, 2 pads an hour for 2 hours straight is a reason to seek medical attention. It can be hard to know how much bleeding to expect with a medical abortion, so we strongly encourage you to call us if you have questions about your bleeding through the process. If you have a fever over 100.4 that lasts more than 6 hours, call us. The misoprostol can cause a fever, but we want to know if it's lasting a long time. If you have pain that is uncontrolled with a heating pad, pain medications, or rest. If you have severe diarrhea or are throwing up for more than 6 hours, call us. The misoprostol can cause nausea and diarrhea, but we want to know if it's lasting a long time. If you do not have any bleeding or have just spotting after the misoprostol, try another dose the next day. If you still do not have any bleeding, call us immediately. Although rare, ongoing pregnancy is a risk with medical abortion, and we will need to coordinate the next steps. Also, if anything else is wrong, if you faint, if you think you've had an allergic reaction, if you develop a rash, give us a call. We're here for you. Most people feel well enough to return to their normal activities the day after they take the misoprostol. We are happy to write you a work note if needed. After taking the medications, you will need some follow-up testing to confirm your abortion is complete. This will either be an ultrasound, 2 blood tests, or a urine pregnancy test. Your provider will discuss with you during the video consultation which is the best method for you and where you can go to obtain the tests. You will need to talk to a provider to review your test results and make sure you are feeling okay. We will ask you a few questions on how satisfied you are with your TelAbortion care and any difficulties you had with the process.